session. Today, joining with me is Dr. Vijaya, and we are going to discuss a very beautiful, a very informative, and a very common topic, which is constipation in children. What are the causes and the symptoms? So, I welcome Dr. Vijaya on board, and over to you, Dr. Vijaya.
Okay. Hello, parents. Good afternoon. It's Dr. Vijaya Kattimani. I'm a pediatrician, and even I'm an expert. I'm an expert in behavior management in children and an expert in allergy and asthma. And now I'm practicing. Like I completed my MD Pediatrics in 2017, so 8 years of experience. And I have my own like Kattimani Children Hospital. I'm running Kattimani Children Hospital in Hubli and Haryal.
Wow, that's such a
Thanks.
beautiful start. So, Dr. Vijaya, when we talk about constipation, every mom is worried that, whether the bowels are not clear or the child is having a difficult time passing motion. So, what can be the common cause for constipation in children? Can you please help here?
Yeah, yes, Dr. Pooja. See, constipation, it is the most common like complaint with parents come with. Nearly in our common pediatric practice, nearly 10% of the kids, they will come with the constipation. So what is meant by constipation then? Constipation means passing hard stools with
Right,
difficulty and less often than the
right.
normal. So this is known
Okay,
as the constipation, and it is known as significant. When we can consider it as a significant, when it lasts more than 4 weeks. So whenever,
okay,
so that is known as a significant constipation, and so it is passing hard stools and less often than the normal. So what is the normal frequency of the passing stools? Otherwise, 40. So it is age wise. If it is a child less than 1 month, the child will at least average number of the stools per day should be 3 to 4 times per day, and 1 month to 1 year, 2 to 3 times per day, 1 to 2 years, at least 2 times per day, and 2 to 18 years, at least child has to pass 1 time, 40 per day.
okay,
So this is the
okay.
normal frequency. Whenever there is an alteration, then like it can be considered as a constipation. But another thing has to be noted that some of the newborns, they will pass the stools even once in 5 to 6 days
Correct.
until unless your child passes normal pasty consistent stools without any difficulty. So parents are worried about it. So this is
Correct.
about the constipation and about the common causes. So the
Right.
most common cause of the constipation here is functional constipation. So there are two types. One is functional constipation, another is the organic causes causing constipation. What's meant by functional constipation? Functional constipation means there will be no proven causes. So that
Okay.
is known as a functional constipation. And very good thing is that it can be treated. So
Okay.
here the most common causes when we consider,
Uh-huh.
and 95% are functional causes only. Most common
Okay.
causes are first when we take whenever there is a change in the routine of the kid, like the child
Okay.
who used to pass in the morning, it has been skipped. Otherwise, non-availability of the toilets during traveling or because of any other circumstances or
Mm-hmm.
any recent changes, even acute stresses.
Hmm.
Suppose there is any changes in home, otherwise change of the school,
Hmm.
otherwise many major changes which has been happened in family recently, loss of near one or being away from near one, and even sibling rivalry also, even intercurrent illnesses. And if you
Okay.
can consider dietary
Okay.
factors, they play a major role in children causing the constipations. What are the dietary factors? The diet which is like deficient in, or which is deficient in dietary fibers like green leafy vegetables, fruits, cereals, pulses. The children who are taking a lot of oily, greasy, and junk foods,
Right.
and the kid who is predominantly taking milk and milk-based products. And
Okay.
it is very more common in water-fed kids and the
Okay.
infants who are on formula feeds. Recently, if there is a change has been occurred in the selection of the formula feed also, will cause the constipation,
Concept.
and even the children who are taking less amount of fluid also. These
Okay.
are the dietary factors and even acute stresses, and too early toilet training, too
Mm-hmm.
rigid toilet training also will cause constipation. And if you can consider medical causes, a
Mm-hmm.
lot of nearly only 5% of the cases Some of the medicines also will cause constipations. Like some kids, because of the anemia, they are on the iron drops or something. That will also cause constipation.
Constipation.
So
Right.
yeah,
You have
so these are
covered,
all the most common causes.
yes, in depth, you have covered mostly about the different types of
Yeah,
constipation and how
yeah.
a
Dr.
mother
Pooja, we left
identifies.
another thing. Yeah, the
Yes,
child who has a habit of postponing the defecations, mainly
yes,
those who are nowadays children, there's an increased screen time. So they are so much involved in watching TV, mobile, otherwise playing video game, they will skip going to the, otherwise
yes,
they will not give concentration to go to the potty. Otherwise, they are just too lazy to go to the toilet also.
absolutely.
Otherwise, they just want to, these are the most common we can think. So these are the
Right.
common.
So when we talked about the causes, can you also help us with how can we relieve the constipation? In what ways
Yeah.
can it work for the moms to work it in a better way?
Yeah. See, this motto of the session is that parent, they have to understand what are the most common causes, signs and symptoms of the constipation so that they can early intervene, early recognize that their child has been constipation, and we can prevent the long-term complications. Here,
Correct.
parents, I want you people to understand here parent counseling and the education about the constipation is very important,
Yes.
because parents should know the pathophysiology of functional constipations, why their kids is struggling to pass the potty. That's the
Correct.
main thing. Whenever if there's a constipation, the child has not passed the stool. What will happen? It will remain in the body. Whatever the potty which is remaining in the body for a longer time, what will happen? It will become very drier, more bulkier, again more harder. Again, what will cause? It will cause painful painful evacuation, painful defecations. Because of that one, child will have a fear. Child will postpone the passing the stools. Again, the child will postpone the passing the stools. Again, it will become more harder, more drier, more bulkier. This vicious cycle will go on.
Correct.
So these things has to be prevented. So how can we prevent? Parents, whenever they are seeing their child is going to the corner or otherwise going behind the curtain, standing cross-legged, otherwise holding on the table and bending forward. These are the some postponing postures people parents have to recognize. And whenever these symptoms, the child is not passing stool more than 2 weeks, abdominal pain, and the child has a bleeding while passing the stool. These are the
Okay.
main concerns. They should not delay. They should take immediate management with their doctors or pediatrician, pediatric surgeons, and they have to take the medical attention. So, in the management, if we can consider, nowadays because of the reduced activity, they have to encourage the physical activity, decrease the screen time, increase the indoor, otherwise outdoor activities. So, whenever there is an
Okay.
increased activity, it will increase the bowel movements. So, whenever there is an increased bowel movement, it will lead to the easy passage of the stool.
Yes.
So, concentration on the physical activity is important. Change in the diet. So, diet. Make sure that give the baby the diet which is rich in green
Green
dietary
leaf.
fibers.
Yes.
Yeah, dietary fibers means like green leafy vegetables, all subsies you can give. And it has
Okay.
been proven that if you give nutmegs, nugekai, and this mulangi,
Correct.
radish, this will they are very good purgatives. If people can use those things in your food pattern, use cereals, pulses, fruits, and you know that if you give banana, it will give there will be easy passage of the stools. That is our ancient and Indian culture. So
Yes.
make a change in the food style, and encourage your kid to have a lot of water.
Okay.
And even the toilet training is very important. In the toilet training, parents should assess the readiness of their child to for the toilet training. Ideal age is 2 to 3 years. Otherwise, just to see whenever your child is ready, you can start the toilet training. So for training, you just schedule a routine timing. After that, the correct whatever the potty instruments, whether it could be Indian closet, Indian type of toilets, otherwise whatever the Western, then demonstrate them the posture. And
Right.
it has been proven that our Indian potties are the best because there will be
Yes.
the angulation between the thighs and the abdomen, which will causes easy passage of the stool in case of kids. Encourage
Yes.
the kids. Do not scold the kid. These all toilet training, diet, and if this is significant cause constipation causing like the child has become very miserable, crying badly while passing the stools, kindly visit your doctor, take your pediatric opinion for the acute symptomatic relief. Sometimes they can give you suppositories, otherwise enemas, followed by maintenance treatment by any of the purgatives like stimulant osmotics, otherwise stimulant purgatives they will give. Maintenance therapy. Some of the kids in our practice, we have given nearly even 5 to 6 months of the course, followed by regular medical follow-up with your doctor, pediatrician. Your child's constipation will be relieved. So it is
Relieved.
just a combination of everything. Parental education, counseling,
Correct.
then change your diet, encourage green leafy vegetables, dietary fibers, and water. Then regular good toilet training, increase the physical activity.
Right.
Uh, then increase the physical activity. Then what we can do with your medical intervention by doctor. So these are
Okay.
the five methods. Like with that,
Okay.
constipation will be relieved.
So a mother is asking me a question. She's saying that her child is having difficulty in passing motions because he eats too much of junk food. So what is the
Yeah.
modifying behavioral changes that you could advise to the mom? And her child's problem can be resolved.
Yeah, that is true. See, these junk foods, especially whatever the junk foods having a lot of maida, oily foods, these will what they will cause, they will decreases the bowel movements or peristaltic movement in the abdomen. So digestion will not happen
Right.
properly. Otherwise, it will take a long time to get digested. So these
Correct.
things has to be, so again it will promote the constipation. Again there will be like the child will postpone the passing the stool. Again day by day the child will not pass, and stool it will become harder and harder, bulkier, and child will be afraid of passing stool. Again vicious cycle. So we have to
Correct.
break down. So my advice to the mother, just make food as an interesting thing. Make different whatever the like cartoon kind, like if you are giving green leafy vegetables, otherwise you just make whatever the drawing cartoons kind of, take all the fruits, cut it, make something interesting, take colorful plates, those all things you can try it on. And make sure that you will give healthy food. Healthy food means home baked, easily cooked and boiled, which is easily digestible. Food will never cause constipation in the children. Promote green leafy
Okay.
vegetables, cereal pulses, and drink plenty of water.
Okay. Dr. Vijaya, one more mother is asking me that how do I make my child drink more water? So what are the
Yeah.
technique
Yeah.
tips can you share here as a doctor?
No, no, no. Yeah, this is a common, even being a mother, even I have faced it actually. See, many people, they will train their kid to have the water through glasses also.
Yes.
Nowadays, a lot of colorful mugs are present, and their favorite cartoons, Bheem, Elsa, uh, frozen characters, our Doraemon. So all the mugs with the different colors they can take, sippers, many kind of sippers, depending on their age also is available. So they can go for that. And make sure
Correct.
that every hour, if, let there be a reminder for the mother
Okay.
also. And being a mother, let them remind every hour to have a water either with any of these things, glasses or something. Otherwise make them play with their peer group,
Okay.
just as a like while making them play one by one, just teach them to drink the water. Kid, they will see by seeing other kid. So once other kid drinks, they will also drink. So these are many tips you can try, I think.
Okay. Thank you,
So
Dr.
make sure
Vijaya.
that they will drink plenty of water.
Yes, these were the wonderful answers to the questions that we have had, and I had a lovely time listening to you. But before we come up to the end of the session, I would like you to just summarize as a takeaway message for all the moms, and handful tips which will help these moms to solve the problem of constipation in their children.
Okay. See, yeah, as I have already told, constipation is passing very hard tools and less often than the normal, and with the painful evacuations. So whenever and it is significant when it is more than 4 weeks. Whenever your child present with a significant constipation, make sure at least once you visit your pediatrician. And just to conclude, and to rule out whether your child doesn't have any organic causes. Here, Dr. Pooja, we just forgot what are the medical causes which will cause the constipations. Here,
Right.
I want you people just go and make your head to toe examination of your kid. And if any investigation needed, let them do it. And they have to exclude mainly hypothyroidism, where there will be constipation with delayed milestones and other clinical features, and even congenital surgical causes, which will need surgical interventions like Hirschsprung's disease, spinal
Right.
cord anomalies,
Right.
and these all causes, and any delayed cystic fibrosis, delayed meconium passage, like anomalies like anal stenosis. These all things have to be ruled out. Once you go to your doctor, they will just tell you whether it's organic or functional. Whenever it is a functional constipation, nothing, don't worry. Just rule out the most common causes, as we have already told, like whenever there is a change in that, change their routine, change their lifestyle, make a strict and routine timing, encourage the and change their diet style, also change their physical activity if they are very inactive, otherwise screen time oriented. Just rule out all the causes. Then
Right.
you have to make sure that what are the changes you want to do. You have
Right.
to just make, you have to teach your kid, do a correct toilet training depending on their readiness, correct like correct type of instrument, like whether a Indian toilet or like Western toilet, uh, rigid timing, demonstrate the posture. So toilet training is very important. Then encouraging the good lifestyle with increased physical activity, and encouraging with good food, which is if it is a bottle fed infants, just a switch over to the like you have to restrict the milk and milk related products.
Products.
And milk,
Okay.
however, milk can be given in the permissible quantity for your kid. So restrict the milk
Oh,
products, and encourage green leaf vegetables and all, and water intake. And behavioral management is also important, as you asked. Restrict them having all the junk foods and other foods which will take a longer digestion, and the easily digestible food has to be given, and encourage plenty of the water. So here at the end, so constipation needs a medical attention, encourage the physical activity and decrease the screening time, increase the toilet training, change the diet with green leafy vegetables, fruits, pulses, encourage your kid to have plenty of water, and at the end, symptom relief with the medication as prescribed by your pediatrician, along with your parents' cooperation, otherwise parents' participation in changing your baby's lifestyle, and physical activity is very important.
Thank you so much. And also, you're taking your valuable time out of your busy schedule. So the moms at the Baby Chakra community are really thankful for you, for those who have joined us. And secondly, if you want to, reach out to Dr. Vijaya, you can download the Baby Chakra app and ask her questions, tag her onto it. She will definitely help you out in answering your any questions in related to childcare. Thank you, Dr. Vijaya, for spending your valuable time. It was lovely talking to you.
Thank you so much, Pooja.
Thank you, ma'am. Bye.